Well, good morning. It gives me great pleasure to be here and see all of your smiling faces. It reminds me of church. Those of you who are way up there could come down to the front later on and after the break. What I'd really like to talk about, as both Susan and Claudia mentioned, is how the IOM report came to be and what kind of implications that has for you as students and then you as practitioners. It'll be a brief presentation, and you do have a handout that relates to those recommendations. So I'm not going to belabor those, but rather ask you some questions, give you some questions to ponder. Really, the IOM report that focused on nursing, as we'll talk today, was not the first to focus on quality. In fact, in 1999, there was a report that hit the Chicago Tribune, front page news, 95,000 patients killed by medication errors. I remember seeing that. I remember where I was. I was at an NLN baccalaureate education conference in Nashville, Tennessee. It's something you don't forget. And at that point, the healthcare system really was very broken, and there was a major emphasis from that point on related to patient safety, quality. The other piece that is significant about that particular report was that it really changed the emphasis of a blame-placing environment where individuals were responsible, if you will, for errors, for medication errors, but rather it was now being viewed as a system failure. New terminology. We had a very punitive environment. Those of us who've been around for a long time can remember that environment. But the shift started to come about in relationship to that huge Chicago Tribune blazing editorial. And so that we were then focusing on building a culture of safety. So following that, obviously, were several reports focusing on transforming healthcare quality, preventing medication errors, and really advancing quality improvement research, something that we'd not really focused on before. We also looked at confronting racial and ethnic disparities. We looked at leadership by example, and relationship to leadership was really who was going to lead in terms of quality improvement efforts and how they would then transform our healthcare environments. Health literacy became a term that we heard more and more and related it to, if you don't understand as a patient what you are expected to do, how might you comply, and then what kind of effect does that have on patient outcomes. That led, in fact, to the development of the IOM's core competencies, which you can see before you. They identified 5 core competencies, and those were provide patient-centered care, which seems relatively simple. Of course we would. Employ evidence-based practice. Evidence-based practice was not a term we heard 20 years ago. Evidence-based practice now is a term that lives in your lives on a daily basis in clinical. Apply quality improvement. Again, quality improvement is a term that really has come about much more so over the last 10 to 15 years. Interprofessional teams. We all talk about collaboration, working with one another, but silos continued. And really the emphasis on understanding roles from a nursing, a physician, all of our allied health professionals really had not been emphasized, not in our educational processes across the healthcare disciplines, nor in our clinical settings. And the use of informatics. All of you know that technology has exploded over the last 10 years and will continue to explode based on the support for clinical decision-making that's being required by regulations and laws that tell us we must meaningfully use our information systems to help support our clinical decision-making. Out of that, and you all know QSIN, I'm sure, Quality and Safety in Education and Nursing, which came about in the early 2000s and really was developed by the Robert Wood Johnson Foundation and has emphasized education across all program types so that you as students will have an understanding of quality and safety that students in the past did not have. If you were to ask a nurse who graduated 15 years ago about quality and safety in nursing education, they may look at you very strangely because they weren't educated. Yes, the terms safety and quality were certainly in their terminology. However, they were not educated in the same manner you are being educated today. So we face a gap, if you will, in terms of the knowledge that our practitioners who have been out 5 years or greater, that will also have an impact in terms of patient outcomes that we need to address. So how do we move forward into the Future of Nursing report, which some call the first major report in 25 years to actually focus on nursing? And this is true. This is a landmark in our lives as professionals. So how do we, as Claudia and Susan said, take advantage of this and use this in our daily lives? So I have some thoughts. And these are related to the 4 key messages that I'm sure you have emblazoned in your minds. So while these are perhaps repetitive in terms of what you know, what I'd like to do is have you think about these. The first key message is nurses should practice to the full extent of their education and training. Now, this seems relatively simple, does it not? I know you're all awake out there, I just can't see you. How do you know your scope of practice as a student? Anybody want to take a shot? How do you know your scope of practice as a student? Who tells you that? Who guides that? I would suspect your clinical instructors guide that. And it goes by course objectives, and you progress from one course to the next. So it's a guided experience. But how do you know your scope of practice when you become a nurse? I would hope that you know your scope of practice from the state in which you practice. So whether it's Missouri or Kansas or Nebraska or Iowa, Texas, that you will have read your scope of practice prior to entering your first job. And what would impede your scope of practice? Perhaps you're in an environment where physicians have determined that you may not follow protocols, that you must call a physician to order something as simple as an aspirin. That does occur. I have a colleague who was sharing that in the state of Georgia, in an emergency room, you cannot administer an aspirin unless you receive an order from a physician. Now, that impedes your scope of practice. If you should move on to an advanced practice role, what might be the barriers to your practice as an advanced practice nurse? We in the state of Missouri have been very actively engaged in removing barriers from our environment, whether they're barriers in relationship to administration of controlled substances, whether we're looking at how much oversight physicians need to provide, because these barriers can impede ultimately access to quality health care. So we need to think about why we need to practice to the full extent of our education and training. We don't often think about that and how quality can be impeded if our practice is impeded. And then how will I integrate best practices into my role as a student? Can I integrate best practices? What if I find that a change needs to be made within the context of the unit on which I'm practicing as a student? How do I go about making that change happen? Key message 2. This is very near and dear to the hearts of those of us who are educators in both Kansas and Missouri. And we spend a great deal of time talking about this and looking at strategies that can facilitate the transition from one level of nursing education to another. And we value all levels of nursing education as a group of educators because we all have a place. What we also value is the need to move from one educational level to another. And we know from statistics that moving to advanced levels declines over time, so that an individual may move from an ADN to a baccalaureate level, but the likelihood of that individual moving on to an advanced degree declines significantly. So we need to look across all program types and determine what it is that we can do to facilitate that. So the first question is, wherever I am in my educational journey, what would additional education mean for me? What kind of impact would that have on me as a nurse? I also need to think about whether I want to be at the bedside or do I want to move into a management role. And if I want to stay at the bedside, how do I do that and continue to move forward in that educational journey? And how will additional education affect patient outcomes? And there have been a series of articles, most notably by Linda Aiken, talking about the effect of education on patient mortality, followed up by research in Canada that has also supported Aiken's findings. So we know from the literature that we do have an impact on patient outcomes in terms of our educational level. And what should I be considering now? Those of you who have just started are saying, I've just started. But this is the time to begin to consider where you would like to go in that journey and how that fits in with the recommendations and the key messages of the IOM report. Key message number 3, nurses should be full partners with physicians and other health professionals in the redesign of healthcare in the United States. This is one that's a bit tricky because I listen to our students because I do the lecture on health policy, and that is about as important, I think, to students as watching paint dry. And I'd like to get past that because health policy is so important to us and how to have a voice in that. And beginning to think as a student, how do I do that? Otherwise, we can never be full partners with physicians and other healthcare professionals. So what does it mean to have a voice in health policy as a student? Where do I learn about having a role in making decisions about healthcare? Within our environment currently, the Affordable Care Act is something you can't miss because it's something that's been discussed, battled, challenged, etc., for the last 3 years at least. It began in 1992 with the Clinton administration when we talked about health care for all, and as you can see, that didn't happen. There was a great emphasis there on advanced practice nursing, really the same kind of focus as we're looking now to provide primary care to those additional individuals who will be insured under Obamacare. How do we move that forward? We weren't successful in 1992. How can we be successful now? Because patient outcomes, access to quality patient care rests on the fact that we have a voice in what is occurring in our healthcare environment. How many of you vote? How many of you will vote in November? Okay. It doesn't matter for whom you cast a vote. It matters that you vote. I think the last statistic was 1 in 52 are nurses in the voting population. We have a huge, huge impact on what occurs in this country, and we need to be sure that we engage in that dialogue and have a voice in what happens in our country, because it does have an effect on us, most definitely. The other piece in relationship to being full partners with healthcare professionals is learning how to be a leader. And I don't mean necessarily a leader who has a host of followers. I mean a leader within one's unit who who people feel comfortable working with in order to lead, whether it be yourself or whether it be others, so that we can have a voice in what occurs over the next decade, 2 decades, 3 decades of your practice. And how do I find a workplace environment that's supportive of that role? When you graduate in May, June, not too far away, how will you find an environment that supports the fact that you will be a full partner with physicians and other healthcare professionals? What are the questions you need to ask? Perhaps it's looking at the environments in which you do your clinical experiences. Look around you as you are in your clinical environment. How are nurses treated? Do they have a voice in shared governance? Do they work with physicians and other allied health professionals? Do they have a voice in making decisions that affect patient care? That gives you a good understanding from kind of an inside perspective view of these clinical environments, and then perhaps whether you would like to stay in that environment as a new graduate. And lastly, key message number 4 has to do with better workforce planning and policy making around data collection and an improved information structure. Sounds like a lot of words, and what do I have to do with that? We in this country do not have a mechanism as a whole to collect data about nursing workforce. We have pockets of that within our states. We have a beginning development of workforce assessment to be used for workforce planning. Why would that make a difference? Well, in order to project, as you perhaps know in the past, we have had individuals like Peter Burhouse who have projected shortages and then have made modifications based on the fact that we have a large number of second-degree students in the population, so we've kind of grown a bit, but also cautioning us as nursing educators not to shorten the pipeline because we need to provide after people retire. Once the economy stabilizes and nurses who have gone to full-time will move to part-time, nurses who are full-time may retire. So we need to keep those pumps primed in terms of having you ready to graduate. But we have no idea across the country what that looks like in terms of demographics. We have no idea in terms of racial mix. We have no idea in terms of what the skill mix is going to be needed. Are we going to need more registered nurses along with more patient care technicians or licensed practical nurses? We have no way of knowing that. So we need to look at why that is important. And it may not be as apparent to you as a student, but it certainly will be apparent as a new graduate, because those are the individuals who are going to be involved in your units, who are going to be hired down the road as practitioners who will work with you, and having individuals who are in leadership roles understand the need for workforce projections. And then lastly, why is it important for me to understand the Affordable Care Act? It's kind of out there. Actually, it's an 1,185-page document. I was at a reception for congressmen at our American Association of Colleges of Nursing reception for people on the Hill when we're in there in October and March, and one of the staffers who really does all of the work was carrying this shrink-wrapped bundle. It was a couple of years ago when this was being voted on. And one of the other deans asked what that was, and he said, "That's what I'm reading tonight," so that he could have an understanding of what 1,185 pages means in relationship to our affordable care. So while I don't expect you to read 1,185 pages, I think it's important for us to understand what it means for all of you, as well as for all of us in nursing education and practice. So out of the 4 key messages emerged 8 recommendations, and you will see that these recommendations obviously tie back to the specific messages. Removing scope of practice barriers. You can attend forums where people are speaking about scope of practice barriers. One of our senior administrators in the area. Dr. Thad Wilson, who is the senior dean at UMKC, is very active in removing scope of practice barriers and a great resource in our community. Expand opportunities for nurses to lead and diffuse quality improvement efforts across all professions. We have the ability to do that. We are the coordinator manager of care, so to utilize that role appropriately. One of the posters today that you will see out there from KU is implementing their nurse residency program and the kind of effect that has had on the retention of new grads. The BSN, increasing to 80% of the 3.1 million registered nurses, 80% of us to hold the baccalaureate degree by 2020. That's where we as educators need to work together, as I mentioned earlier, to help that seamless transition so that you can move from one level to another. Double the number of nurses with doctorates by 2020. Well, you're sitting here saying, why? Well, these are our nurse scientists. These are our nursing education and practice leaders. If you were to look at statistics of that 3.1 million registered nurses, about 1% of them hold the doctorate. 1%. Now, that's growing in relationship to the number of individuals who hold the doctorate in nursing practice, the DNP. But our PhD preparation is really at a plateau. So we need to find a balance between the education of the DNPs and the PhDs to carry us forward so that we have those individuals who can lead in the practice setting, who can lead the development and dissemination of nursing knowledge, and who can lead in educational environments. Lifelong learning. How many of you in your missions, in your nursing programs talk about lifelong learning? We are always learners. Always learners. And as I noted earlier, being leaders, transformational leaders, so that we can move forward and change our healthcare environments. We are the largest population of healthcare providers. Now is our time to do this and build that structure to collect the appropriate data. We can do this. I am absolutely certain of that. I know my colleagues in the greater Kansas City area and how we educate you all to be leaders, to be great practitioners, to move forward to change our healthcare delivery system. And as I close, I'd like to say that you are the next generation of nurses, and you will lead the transformation of this nation's healthcare system. So I applaud you for your choice. Nursing is a wonderful career. It has been mine for 44 years. I wouldn't trade a day, maybe one or two. But it has been an incredible life and journey that I think each of you have a special gift that you will take forward to your colleagues and to your patients and their families. So, thank you for this opportunity, and I will introduce our next presenter. I'd like to call forward Dr. Cindy Teal. She is the Associate Dean, Graduate Programs, and Professor, and most importantly for her presentation today, she is the co-leader of the Kansas Action Coalition. Cindy? Let me take that, get it out of your way.
Great, is this your lunch? Yeah. Okay, great, thank you. Thank you, Nancy. Let me get this switched over.